Good afternoon. My name is Kimberly Haley, and I am the head of infection control here at the Charlotte Metro Public Health Clinic. I would like to begin by thanking you all for your attendance in today's all-staff meeting, where I will be discussing the basics of Ebola virus, as North Carolina is experiencing its first ever laboratory confirmed case. On May 20th, 2024, the Bioterrorism and Emerging Pathogens Unit at the North Carolina State Laboratory for Public Health confirmed a case of Ebola virus disease here in Charlotte. The victim is a 48-year-old male visiting Charlotte from Masaka, Uganda. The victim remains in isolation at Atrium Main Hospital, where he has been treated since May 19th. Atrium Main Hospital has been designated as an Ebola treatment center. Ebola virus is a recognized bloodborne pathogen caused by a group of viruses known as ortho-Ebola viruses and are found primarily in sub-Saharan Africa. There are 5 identified Ebola virus species, but only 4 are known to cause disease in humans. Risk factors for Ebola include workers who interact with people, animals, goods, and equipment arriving in the U.S. from foreign countries with current EVD outbreaks, healthcare providers and family members caring for someone sick with Ebola without proper infection control methods, people who have encountered someone presenting with symptoms or with their body fluids. Ebola is spread through human-to-human transmission via direct contact with blood or body fluids of a person who is sick with or has died from Ebola, objects that have been contaminated with body fluids from a sick person with Ebola, or the body of a person who died from Ebola. People remain infectious as long as their blood contains the virus. After recovery, there is the possibility of sexual transmission. Pregnant women who get acute Ebola and recover from the disease may still carry the virus in breast milk or in pregnancy-related fluids and tissue. You can also get EVD by ingesting infectious blood or body fluids, including meat, from an animal infected with Ebola. Healthcare workers should take standard precautions, including basic hand and respiratory hygiene, use of personal protective equipment, safe injection practices, and safe burial practices. Also, apply extra infection control measures to prevent contact with the patient's blood and body fluids and contaminated surfaces or materials such as clothing and bedding. Here at the Charlotte Metro Public Health Clinic, our physicians, nurses, and technicians collecting specimen samples and any other staff who come in close contact with patients positive for Ebola are most susceptible. Suspected specimens are to be collected and sent to the North Carolina State Laboratory for Public Health, where testing is performed by the Bioterrorism and Emerging Pathogens Unit. All requests for testing must be approved by the Communicable Disease Branch prior to collecting samples. Clinical specimens from patients under investigation are considered Category A diagnostic specimens and must be packaged and shipped following specimen regulations. All physicians, nurses, and laboratory technicians here at our facility are trained and certified in Category A shipping. A person with Ebola is only contagious once they start to display symptoms, which usually appear 2 to 21 days after infection. The most common incubation period is 8 to 10 days. A person can spread Ebola for as long as the virus is in their blood and body fluids, even after symptoms stop, and it can take weeks to months before they are no longer contagious. Initial symptoms of Ebola can be sudden and include fever, fatigue, headache, muscle pain, sore throat, and chills. As the infection progresses, patients often experience nausea, diarrhea, and impaired organ function. A rash and severe internal or external bleeding may also occur. Ebola is important because these viruses can cause serious illness that, without treatment, can cause death. Please remember, the risk of catching Ebola in the general population is extremely low. However, proper protocol should be taken if you or anyone you know has encountered someone diagnosed with or suspected to have Ebola. An Ebola public information line has been established by the Carolinas Poison Center. Please call 1-844-EBOLA-NC for questions about Ebola or email fictitious Ebola training.ethics and leadership at northcarolinaph.gov. Thank you for your attention.